Hey, hello, everybody. Good evening. Well, it is evening on my end. Hello, wherever you are. If you're joining me live or watching on the replay, how are you doing? I'm Dr. Sylvia. This is AskAwayHealth, and you're so very welcome. Tonight, we're talking about fibroids and how they affect our chances of pregnancy. I'm just going to do a quick sound check. I hope you guys are doing well. Let me just see if I can hear myself okay. Hopefully we should get into this in just a few moments. So yes, we're live. Magnificent, fantastic. Okay, right. So if you're watching, please give this video a like. I'd love to hear from you. If you have fibroids and have experienced challenges with getting pregnant, or if it's been something in your journey, and if you have any thoughts around it, your experience, what you've found with your doctors, what procedures, and so on, please share in the comment section. So we're just going to be looking at some of the challenges that women with fibroids have, falling pregnant or getting pregnant, and having a look at some of the ways that we can overcome them. And just by way of disclaimer, of course, my intention here is not to give specific treatment to any individual because that's just not possible, but it's just to provide some awareness and education that hopefully can just help to guide us so that we're in the right path. That's what I hope to do. So please bear in mind that there is no specific recommendation or treatment. It is just for providing information and guidance. Right. So I would like to share a comment from a viewer that came not too long ago. And we're going to look into that in detail, but I just want to use that to set the stage for some of the discussion. And then when we've had a look at some of the background, then we can talk about it. So this was a question that came through, I don't know when, but not too long ago. It says, Doctor, God bless you for your education. I have a subserosal fibroid measuring 11.4 by 8.6 by 10 centimeter at the fundal wall with no complaints but difficult to conceive. I asked for surgery and my doctor said I should get pregnant first and it's not coming. I am worried. Please, any help? So that is a comment, or somebody popped on one of our videos on fibroids, and I think it's interesting on so many levels. I would love to hear from you, really. If you're just coming in and if you just read this or seen this, what do you think? What are the issues around this? Of course, there's so much information that we don't have here. So again, that is why I always put that disclaimer that I'm here to provide any medical advice that is specific to anyone, because it's just not possible to do. But there's so much information and really a lot of modern day health care relates to how much you as a person know, how much information that you provide to yourself, how much information you get, and there is a lot of information out there. So I really encourage people to get reliable information, speak to your doctor, do your research, ask questions. That's always important. That's always so important. All right, so let's get into things. We're talking about fibroids. By way of background, just in case there's anybody who is bumping into this video who doesn't know what fibroids are, let's do a little bit of a background. Hang on, let me just pop this on. Okay. So I've got a picture of fibroids on here, and hopefully you follow me as we have a quick discussion. So fibroids are benign tumors or benign growths, and they arise or they develop from the muscle of the womb. The most common type of benign tumors that women have, particularly in a reproductive age, and they vary in the way that they can affect a woman. So some women can have fibroids and you don't hear anything about it, and some will have fibroids and they cause serious problems, illness, or affect the quality of life. They're much more common as we grow older. We're not even sure of the exact how much impact fibroids have potentially, because like I said, some women don't experience them, and so we don't even count those ones. We only count those whose fibroids bring them to medical attention because they have symptoms. And of course, fibroid symptoms could include things like very painful experiencing pelvic pain, back pain, tummy pain, abdominal pain, pain in the legs. So pain is a big feature of fibroids, as well as irregular and heavy prolonged menstrual bleeding. Both can occur, but women can have them at different times. So experiencing pain for some women is unfortunately part of that fibroid experience. They can also get bloating, constipation, problems passing urine, and of course, it can have a potential effect on fertility. Okay. Who gets fibroids? Why do fibroids happen? Well, why do fibroids happen? No matter what anybody tells you about specific causes related to whether it's a type of food that you're eating or hormones alone, we don't know exactly what causes fibroids because there isn't one consistent factor in every single person. So, to date, from the studies that we have, we don't know exactly what causes fibroids. However, it is true that there are several things that are related that you think this has something to do with this fibroid growth. I've already talked about the age. Fibroids are more common as you grow older. It's more common in Africans, African Americans, Afro Caribbeans. So the African ethnicity tends to have fibroids more from our observation. It's more common if you're heavier and overweight. And of course, there is the effect of hormones. So while they are implicated in the development and growth of fibroids, we can't say that they alone contribute to fibroid growth because there are many, many women who use hormones, for example, the birth control pill, who do not have fibroids. But then there's also a category of women who, with fibroids, experience growth when they take the pill, that is the combined pill, compared to another group of women who have fibroids and they use the pill to control bleeding and it doesn't increase the size of their fibroids. So these relationships are complicated. There isn't one specific thing you can say is responsible. Fibroids, yeah, there's a genetic link, of course. So you might find that it goes from one generation to the other. So there might be a sister, a mom, cousin, female cousin, and so on with fibroids. So it might run in the family. And of course, our lifestyle, habits, or the particular diet that we have may contribute. So we're talking about things like smoking, exposure to stress, having a sedentary lifestyle, for example, being overweight, I've mentioned already, diet that is rich in red meat and soy. So you're looking at animal products, high estrogen containing products, coffee and alcohol, caffeine, actually, I shouldn't just say coffee, caffeine and alcohol also implicated, endocrine disrupting chemicals, environmental pollutants. It's also associated with diseases like high blood pressure and diabetes. So that's just a whistle stop summary of fibroids and what might be associated with them. So if you're just joining, thank you so much for popping in to the channel. We're talking about fibroids and the effect of fibroids on fertility and pregnancy. And if you're catching this live, it will be great to hear from you, hear what your experience is about fibroids, and you're welcome to pop a comment in the chat. And if you're watching on replay, the same, good to hear from yourself. And we're just laying a little bit of a background about fibroids, and we've just talked about what they are. So, how do fibroids affect the chance of pregnancy? Well, the first thing to do is I want us to look at the types of fibroids. So that's why I've got this image on the screen and I've let it play. I think it's a good enough one. It's large size. It will indicate what I'm just trying to describe. So I usually say to us, and by the way, if you don't know what fibroids are, and if I've gone through my little background too quickly for you in this session, I've got a whole playlist dedicated to fibroids. In fact, there are two. There's a podcast and there's a playlist dedicated to fibroids where I deal with symptoms, just symptoms. In another video, I deal with who's at risk of fibroid. So you can actually go through the playlist at your own time and narrow down on any specific area. So we're going to be looking at the types of fibroids and we're going to relate that to how they might affect a woman's chance of pregnancy. Okay, so the first type of fibroid, there are three broad types that are related to where they are located in the womb. So remember that as we talk about fibroids, we're referring to tumors that grow in the muscle, in and around the muscle of the womb. Okay, so perhaps I should actually first start by showing you when I say the womb. Let us look at let's see if I can find a nice one that just tells us about what the womb looks like. And okay, so let's use this one. Yeah, okay, let's use this one. Okay, so this is just a rough structure of the womb. Okay, right in the middle, you've got the womb cavity. So the uterine cavity right in the middle. So the womb is roughly shaped like a triangle, if you like. So at the very top, um, part of the womb that's called the fundus. So that's that straight part at the top, and then you see the two sides coming down like a triangle, ending in the cervix, which enters into the vagina. So that's roughly what the womb anatomy looks like. So the lighter pink is referring to the muscle, while the deeper pink in the middle is the womb cavity where the baby sits. So broadly, there are three types of fibroids. You have the intramural fibroid that grows right within the muscle of the womb. Okay, that's the intramural fibroid. So if you think of the womb as a thick wall made of muscle, the intramural fibroid is growing inside this wall. So it's like a little lump or little or big lump inside the wall, like bumps on a tree trunk. Then you have so that's the intramural. Okay, then you have the subserosal fibroid. I don't know if my pointer can, no, I don't think it will work. Okay. Then you have the subserosal fibroid, which is also on the screen, so you should be able to see that near the bottom. The subserosal fibroid. So if you think of the womb like a balloon, right? The subserosal fibroid, they're like little bumps that grow on the outside of the balloon. Okay, so they're still emerging from the muscle, but they're not growing within the muscle. They're sort of growing, they're going from the muscle and outwards, outside of the balloon. So if you think of them as like little spots on top of the skin, so stuck to the outside, okay, compared to the intramural, which is sort of sitting within the muscle. And then the last main category is the submucosal fibroid, which, if you imagine the womb lining like a blanket. So now we're talking about the inside of the womb, and we're talking about fibroids going from the muscle that are going pushing into the womb lining. So they're going to have an effect on the womb cavity where the baby usually sits. So submucosal fibroids grow and they butt into the womb cavity, where the baby would usually sit. And so just think about, if there was a if you have a blanket, okay, so just if you're sort of wrapped up in a blanket, so the submucosal will be like little bumps on the blanket pushing at you who is inside the blanket. I think that's the sort of best way I can describe it. So those are the three main types of fibroids. And I really wanted us to take a look at this picture, understand where they're located. So there's one at the top, which is within the pink, light pink of the womb muscle, which is the intramural. Then there's the one in the middle, which is the submucosal. So you can see what I mean by how it is growing from the muscle, but butting inside the womb cavity. That's the darker pink here. And then the one towards the bottom, which is the subserosal fibroid, again is growing from the muscle but is pushing outside. Okay, so disregard the one on the other side, the pedunculated. Let's not distract ourselves with that one. I'm just really concerned about these three main categories of fibroids. So if you're just joining, thank you so much for popping in. Great to have you here. Hello, 305 Capricorn. Great to have you here. Thank you for joining. And you said, I got a robotic myomectomy to remove multiple fibroids last month. During the surgery, they found out I have severe stage 4 endometriosis. I'm heartbroken, still don't have kids. Oh gosh. Wow, that's a double whammy. Double whammy. I'm really sorry. I mean, obviously that is so that must be such a lot to have to contend with. I hope you have supportive physicians or specialists who are sort of looking at the different options, helping to manage the symptoms. And I think one of the things I'm really grateful for today is how far medical science has gone, and thankfully that we have so many more options. And it's I think it's, first of all, once you've sort of had the chance to get, how do I put it now, sort of try to absorb this news, because clearly it would have come as a shock. Then hopefully your specialist will be able to have a chat, a discussion with you about what potential options there are to manage the symptoms, and look at what options, what treatment options are, and for having a family. I hope that they're having that discussion with you, and thank you for sharing that with us. I do really feel with you. It must be really difficult at this time. And that's one of the reasons I do like to share these videos, because I think information is so useful for women. I'm really sure, I'm 100% sure that you're not alone. So many women go through such challenging scenarios, and I'm just really sending you thoughts of support for what you're going through at the moment. Okay, so we're talking about fibroids, and we've just been having a little look at fibroids location, and I particularly wanted to share a fairly simple picture that helps to put in context when we're talking about submucosal fibroid, when we're talking about intramural fibroid, we're talking about pedunculated fibroid. This is what we mean basically. So this is a slightly more complicated photograph, but it's the same, really. You can see how the different fibroids can grow. So in the middle you have the womb cavity, so that's where the baby should sit. And if you have fibroids located in all these different areas, like the intramural, submucosal, and subserosal, they could cause symptoms, they might affect fertility. Okay, so before I move on from there, now the submucosal fibroids can cause heavy bleeding during the periods. The intramural ones can also cause heavy periods, and they can contribute to back pain or tummy pain. The subserosal fibroids probably least likely of the three of them to cause heavy bleeding, but they can cause a lot of bloating, and they're the ones that can push on nerves and cause back pain, press against the bowel, press against the bladder, because they're pushing out, you understand? So they can cause those other symptoms. Okay, right. So fibroids may be a factor in infertility issues, and the ones that are most implicated, which you can probably tell before I even say, will be the submucosal fibroids, followed by the intramural, and then lastly the subserosal. So if a fibroid is going to affect fertility, then it's usually with the submucosal, that is the ones that are pushing into the womb cavity, followed by the ones sitting within the muscle itself, and then the last category, the ones that push outwards, out of the pelvis, out into the pelvis, I mean. Okay, so of course, depending on the size and the location of the fibroids, different symptoms, we've talked about them. How do they affect fertility? So, well, the first stage is getting pregnant, isn't it? Now, some fibroids, simply by their location, could affect the ability of sperm to travel and get up into the tube. So if you imagine the fibroid being located, I don't know if I've got a better diagram than this one, a better picture than this one, but let's use our imagination. So if there's a fibroid that's sort of located very close to the tube, and it's a big subserosal one, and it might be the way it's pushing the on the womb or pressing against the womb, it's causing the tube to kink a little bit, and it looks as if the tube is blocked or the fibroid is actually pressing close against the tube, it might cause that tube to be blocked, if you like. It might block that tube. Of course, that could interfere with pregnancy, could interfere with fertilization, because it affects the ability of the sperm to get through or for the egg to travel. So that's one way that a fibroid, that's just by its location, and this is not even within the womb cavity. This is just a potential from a large fibroid that's located near the fundus, that is the top of the womb. So that may affect fertilization. Another possible effect is implantation. So implantation, of course, is when the egg has been fertilized by the sperm, it travels down from the tube to now sit into the muscle tissue. That's what it does. That's implantation. The fertilized egg is bedding or nesting down into the muscle so it can start growing, as you know, it start growing and multiplying. That's the normal process after fertilization. But the problem, if there is a submucosal fibroid, is that it could affect the presence of the fibroid, could affect the ability of the egg to implant, and that's one of the common problems with submucosal fibroids. And let me see if I got a better picture. Let's see. No, that one's small. Yeah, let's stick with this one. So there are two submucosal fibroids in this particular image. There's the one that's labeled, and there's the one sort of hanging down from the top of the fundus. That's the pedunculated one. So both of these ones, especially if they grow, can affect how the baby can plant into the womb cavity. So after the fertilization happens, the next step is implantation, and implantation simply means that the egg that's been fertilized is going to nest into the muscle. But the fact that the fibroid is there taking up space or just providing a rough surface makes it difficult, and that is a possible cause of fertility problem. Another effect is that could happen, of course, even if implantation does happen successfully, then the baby has to grow. So the cells have to multiply. The fact that the fibroid is there could prevent that growth. And because the baby can't grow, what happens is a miscarriage develops. That could be one cause of a recurring miscarriage. So because the fibroids are there, even if implantation has happened, the fibroids being present within the womb cavity don't allow the egg to grow, or the baby, I should stop calling it the pregnancy egg, don't allow the baby to grow beyond the particular size, simply because the fibroids are located within the womb. So that's another way that fibroids being in the womb potentially could affect fertility. So we've looked at how just fibroids could affect the whole business of getting pregnant and fertilization, how they could affect implantation, and how they could affect even the progress of the pregnancy, that is leading to recurrent miscarriage. Okay, now I've spent a lot of time saying all that, but I think it's really important to say that when a woman comes to talk about having fibroids does not automatically mean that you will end up with fertility issues, because don't forget that many women do have fibroids and they don't have any problems with getting pregnant. They're able to get pregnant, carry their pregnancy to term, and without any problems. And it's also important to put into context that when we're looking at the causes of infertility in a woman, fibroids are not at the top of the list. You'd be very surprised to hear that there are other causes more likely to lead to infertility than fibroids. And that is why when a woman is having challenge, or when a couple are having challenges with fertility, it's important to have a full screen, a full workup to identify what is responsible for the fertility, and not just assume that because she has fibroids, it must be the fibroids causing it. And I think probably that is where we have not educated ourselves treat as well as we should, or our women as well as we should. And so women labor under that impression that, oh, because I've got fibroids, it means I can't get pregnant. That's not true. It's really important to have a full assessment before we can work out whether this challenge with getting pregnant is because of the female or is it because of the male. Even in a woman with fibroids, and if we decide that after tests have been done, we identify that everything else seems to be working okay, then we can look at what to do in terms of treating the fibroids. Right, so let's move on to, we've sort of explored, which is the key thing I wanted to get across tonight. We've explored some of the challenges with getting pregnant if fibroids are present. So let's look at some of the things that can be done. So we know that the biggest culprits are those submucosal fibroids. They're the ones that distort the womb cavity. They're the ones that have the biggest impact on a woman's fertility, implantation, and they could lead to pregnancy loss or miscarriage. So the first thing I think will be, if a woman has fibroids and is trying to get pregnant, the question to ask is, what are the fibroid symptoms? Does she have any fibroid symptoms? That is, aside from she comes and says, I'm having problems, we've been trying for a baby and nothing's happening, I've got fibroids, and so on. It's important to look at whether she has any other symptoms, for example, heavy bleeding, pain, constipation, because as you can imagine, that's not going to put you in the mood to do anything. That will create a state of constant or chronic stress that can affect libido. So probably not having sex as often as they should in order to get pregnant. Now, if a woman wasn't trying to get pregnant with those kind of symptoms, for example, heavy bleeding, what we would usually do would be to look at maybe some hormonal treatments to try and control the bleeding. But that is those are not our options. That's not, we will not be looking in that direction because we want, she's trying to have a baby. So the options are probably limited, and it may mean that we need to deal with those symptoms at the same time to try and look at addressing the fibroids. So treatment might be that they have to remove the fibroids to settle the bleeding, to settle the pain, if it's constipation or whatever, because you're trying to improve quality of life. And at the same time, simply because of if those symptoms were affecting libido, were affecting the ability to have regular intercourse that will lead to pregnancy, then you've sort of killed two birds with one stone, if you like. But the key thing is you're looking at the symptoms that may accompany a woman who says that she's also having problems getting pregnant. So if the issues are not symptoms, for example, I shared with us a comment from a viewer. In fact, maybe I should bring that up now. So let's look at that again, just to remind, especially if you didn't join us from the beginning. So let's look at that question. So this is somebody who said, I have a subserosal fibroid measuring 11.4 by 8.6 by 10 centimeters at the fundal wall with no complaints, but difficult to conceive. So this is somebody who doesn't have symptoms except that they cannot conceive. We don't know. There's so many things that we don't know, but I wanted to just remind you that it is possible that there are no symptoms and it's just difficulty to conceive. They said they've asked for surgery. Their doctor said they should get pregnant first and it's not coming. So they're looking at what can they do next. Okay, so I'll come to this. I don't really want to talk about it now. I want to go through some of the points I think that are important for if you're trying to get pregnant with fibroids. So I've mentioned this already, but I want to emphasize that the very next thing is to have a full infertility workup of the couple. Please, it's really important, because a lot of the time we're making women carry around this burden. Oh, she's got fibroids, so she can't have children. And it's important to remove that burden from women, because like I said, when we look at all the possible causes of infertility in a woman, yes, of course, problems with the womb structure, of course, are on the list. But there are other causes, for example, problems with the tube, problems with ovulation, like hormone problems that are related to, or endometriosis that are related to fertility, as well as fibroids. So we just make that assumption that it's not possible. And we had an example. Somebody shared her experience, a recent experience, just at the beginning of this stream, and said they had a myomectomy to remove multiple fibroids, and it was during surgery that they were discovered to have endometriosis. And I think I'm really grateful that she shared that with us, because I think this is a real experience. Sometimes you might not be able to pick up all the issues around the fertility, and you may assume that, okay, it's the fibroids, but then there may be something else responsible. There may be something else going on. And so now, with that awareness of what the issues are within the womb, now the doctors will be better equipped to think, right, what is it? What are the options for treatment? So the point I'm trying to make here is a full infertility workup in any woman who comes saying that she's having challenges getting pregnant. Even if she has fibroids, we do not assume that fibroids are responsible for the fertility issues, and that workup has to include the partner as well. Okay, so the next thing is, right, if she's had her fertility workup and everything else is fine, her partner is fine, semen analysis is okay, then next thing, so it is fibroid. It will depend on the type, the number of the fibroids, the location of the fibroids. And you're now, if you've been watching and listening to this, you're now an expert in which type of fibroids are most likely to cause the problem in terms of implantation. And those are the submucosal ones that press into the inner womb lining. And please I don't want you to assume that intramural or serosal fibroids may not have some effect. They might do, depending on the number, where they're positioned. But commonly, we think that it's the fibroids that grow into the womb cavity that cause problems, that affect implantation. So studies, research has been done showing that when a woman has submucosal or submucosal and intramural fibroid, when a woman has those type of fibroids that mess about the womb cavity, they have reduced risks or chances of pregnancy. Okay. However, when you remove those fibroids, their rate of pregnancy, the chance to get pregnant improves. They are able to get pregnant, they're able to have children once they've had surgery to remove those fibroids that are distorting the womb. So I'm just putting that photo up there again so we can see what I'm talking about. That women who have this type of submucosal fibroids, the ones that jut into the womb cavity, tend to be the ones that struggle most with problems like implantation and recurring miscarriage. But that when they have surgery to remove them, their rate of pregnancy increases. So they're more likely to get pregnant, and they're more likely to have babies, successful pregnancy outcomes. And usually the surgery, the myomectomy, usually will be via a hysteroscopy, which is where the surgeon gets into the womb and is able to remove as many of those types of fibroids that they're able to see. Okay, I would like to add that if you're thinking of having surgery, if surgery is being proposed as a treatment for fertility, then it's important that along with that plan, you're thinking of, once your body is recovering from surgery, so usually within 6 months of having the surgery and the womb healing and all that, you should be starting to have regular sexual intercourse, preparing to have the baby. And I put this in here because we know that fibroids can grow back. A lot of the times there is criticism for, I've come across many women who said, oh, why bother doing surgery? Fibroids are only going to come back. And fair enough. Yes, that is true. We don't deny that. Surgery is not perfect. Myomectomy is not the perfect solution. It would be wonderful if there was a form of treatment where you didn't have to go through the possible complications of surgery. And I know that there are many natural practitioners or functional medicine practitioners out there who would recommend different treatments and suggest that can cure the fibroids. And I think the outcome is variable. It varies from one woman to the next. I would not deny any woman who says that she tried the particular method and it worked for her, but we haven't found so far that it is consistent for every woman that you want to use that method for. So I think we need to be careful. And so far, what we have is surgery as one way to remove those fibroids. And if you're trying to have a baby, then that gives you a small window of about maybe 12 months to keep trying, have the baby before the likelihood of the fibroid coming back, happens. So that's something to bear in mind. Now, the other point I want to make and emphasize for somebody who's trying to get pregnant who has fibroids, please don't spend too much time running after treatments that don't have much evidence that they are working or they're going to work. And I am referring to these natural treatments, herbs or supplements, diets, and so on, because I know the focus for so many of us is something that is natural, something that is not going to put hormones into the body and so on. But please be realistic in your search. The reason that doctors don't recommend natural therapies to treat fibroids is because the evidence that they're effective doesn't exist or it's not very strong. I've just tried to explain that. If you had 100 women in the room and you said, okay, let's use natural therapy for every one of them, not everyone is going to respond in the same way. But if you have 100 women in the room and you say, okay, let's do surgery to remove their fibroids and then give them an opportunity for pregnancy, you're probably going to have a better outcome. And I'm just speaking anecdotally, so I don't have any percentages or figures to that. But this is why we have surgical methods as being the method of choice for the time being, as far as we know at this point in time, for treating conditions like fibroids. Now, there is evidence that some natural measures like green tea and vitamin D may help with symptoms, with fibroid symptoms. And I've done a couple of videos looking at those studies. Some women with pain and heavy bleeding from fibroids, there's evidence that taking green tea and vitamin D for some months can help to reduce those symptoms, but there's no proof that they can completely shrink away and remove the fibroids and cure the fibroids. So please be realistic, be careful with what you expect from the treatment. If you decide that you want to go down the route of non-hormone, non-surgical methods, natural methods, do look at doing it for a period of time and then assess what have you achieved, what are the benefits, where are you. And the reason I'm saying that, I'm suggesting that, is because while if you spend years or I don't know, a period of time waiting for the fibroids to shrink by diet options or by using supplements, as all that time is going, the quality and quantity of your eggs are reducing. You have to bear that in mind as somebody who has fibroids. So it's good to put a timing and say, right, if you want to pursue this particular method, you want to do it for 6 months or however long, and at the end of that period of time, you're assessing where things are, how big are the fibroids and so on, what's the effect on your symptoms, so that you can make a decision if you want to continue with that or you want to go and have a chat with your doctor about options, which might include surgery. And I also want to mention here that some women might need IVF if surgery hasn't helped. And it's important that we explore those conditions, or sorry, those options. I mean, some ladies may have several number of fibroids. They may have fibroids in difficult positions. So they might have different conditions where they need to have IVF because natural pregnancy is not possible even with surgery, or maybe surgery cannot do what it needs to do to help them to get to remove the fibroids and provide a way for them to become pregnant. So big challenges, but things that need to be discussed early on with their doctor. If you're interested in getting pregnant and you have fibroids, please don't lose hope. Please don't lose hope. There is a lot more that we know today. There is a lot more that we have access to in terms of treatment options. Like I said, a lot of the information I come across is I think it puts a large burden on women with fibroids and tries to paint a no hope, big challenges, a big problem scenario. And most of the time, it is not true. But there are a lot of very loud, distracting voices, and it can be very confusing trying to work out what should I do. And yes, I will acknowledge it. Sometimes there isn't very much patience with women who have fibroids in terms of what the options are. And it's, oh, you either have a myomectomy or there's nothing else, which is not true. And I do appreciate the distress that this can cause, the challenges, apart from having to go through the pain of the symptoms or the other symptoms. You're trying to have a baby, the emotional stress, the mental stress. There is a lot involved. Um, but please don't give up. Please don't give up. It's what's involved is seeking a specialist who is supportive, um, reading widely, trying to get as much information so that you can look at what is best for yourself, um, and trying to explore those options. But don't get stuck in a particular method that you've picked up from Instagram or from TikTok, from somebody saying, oh, that this worked for me, therefore it's going to work for everybody else, because that's not true. Don't just, somebody has shared their experience. Okay, fair enough. Then go and research that experience. And don't just assume. And a lot of those treatments that are the natural treatments can be quite expensive. And fine, if you have the money to spend, fair enough, but is it going to achieve anything? So you're not just pouring that money away. It's good to have a balanced view, is what I would recommend. So while waiting, whether it's whichever option that you're going to go for, whether it's surgical or not, a healthy lifestyle, a balanced diet, regular exercise, avoiding stress, these are all essential. Cutting away alcohol, tobacco, caffeine, cutting those away. Cutting away sugar. Diet is important, even though it's not the main and or the only cause, as we know, of fibroids, but it is definitely implicated. So sugar, animal fat, processed foods should be avoided. At the very least, they will help you to maintain a healthy weight. They will help with your heart health. They will help to cut down inflammation in your body. All of these things which can promote or increase the risk of developing fibroids, they contribute towards high blood pressure and diabetes, which, as I said at the beginning, are chronic diseases associated with fibroids. We've talked about regular exercise, supplements like folic acid, myoinositol is an important supplement that helps with ovulation and fertility. So these are some of the things that I think that a woman who is trying to get pregnant with fibroids should consider in terms of discussion. I'm hoping that if you have fibroids and you're listening to this and hoping to get pregnant, I am really hoping with you that you will get your desire. And I do very much believe that with the right information and care, that you'll get a choice. You'll find the choice that will work best for you and your family. When a woman with fibroids does successfully get pregnant, we need to monitor her very closely during pregnancy, regular visits to your doctor, your specialists, just to make sure that you and your baby remain healthy throughout the pregnancy and after baby is born. Right, so before we go, I'm going to look at that question again that was shared by somebody watching my video. I don't know what you guys think about this question. I just had a few issues about it. So now that we've sort of gone through a little bit of background on the challenges and have a bit of background on how the types of fibroids affect fertility, let's see if we can answer this question. So subserosal fibroid. So you guys now know that the subserosal fibroid is the one that's less likely to affect the womb cavity. However, I don't know what you guys think of the size. So let me just show you in terms of fibroid size. So this is 11 by 8 by 10. So here is a look at the potential fibroid sizes. A small one is about 2 centimeters. An average one is between 2 and 4. Sorry, 2 to 6. Yeah, so 2 to 5 or 6 centimeters. While big or large fibroids from 6 centimeters, 7 centimeters upwards. So this person is talking about large fibroids. 11 by 8 by 10. So that's the large one that they're talking about, but it's subserosal at the fundal wall. So let us see if we can find if it fits any of our pictures here. Well, no, we don't have any. I don't have a picture of one with at a fundal wall, because the fundus is right at the top here of the womb. So if it was subserosal, if you had a subserosal one, it might be pushing against the tube. I don't know. We're just sort of doing guesswork, aren't we? Because we don't really have much information. But so she has a fibroid of that size and she does not have symptoms, which is not unusual because we know that subserosal fibroids, well, they don't really cause too much problem with bleeding, but they can cause problems like constipation, they can cause pain. But this person says they're not having any complaints. Their main problem is that they haven't been able to conceive. Now, she says she asked for surgery, and this is the point I was trying to make for you guys earlier, that we have let down our women so much that they just assume fibroids is a sentence, is a life sentence. Oh, difficulty getting pregnant. I'm not I'm not saying that it's not a challenge. I'm saying that there could be other reasons. This is a large fibroid, so it's possible that this is related. I don't know what's in the mind of the doctor because she says she asked for surgery, and I don't know. Did they have a discussion as to, or did they have it? Has she had a full workup? Have she and her partner been for a full workup, and there is nothing else responsible for the fertility challenges? So that's why that is important. How old is she? How often is she having regular intercourse? Remember, 3 times a week, at least 3 times a week is the average recommendation. The fact that she's got fibroids and she's saying that she's having problems conceiving, she should have a full workup so that we work out what's causing the issues. Is she ovulating? What about her tubes and her partner? These are all areas that should be examined before we can make any conclusions. So she wanted surgery. The doctor says, no, get pregnant first. And there seems to be some disconnect, which I think is really unfortunate because I would have hoped the doctor would have sort of sat down and looked at all the issues so that she's educated and she knows what it is that she's doing. She's having a problem. She's saying it's not coming, so the doctor really needs to be looking at what else is going on. So I think in this instance, yes, of course you can always get a second opinion, but there are a few things that I would expect that the gynecologist or obstetrician would say, let's do hormone profile, let's look at all the other information we need, let's look at your partner, and then let's have a seat. How old is she? And look at all those factors to determine, okay, surgery is not necessary at this point, but this is what you need to do to have a baby. Or actually, it is the fibroid that's likely causing the problem, and then let's plan for surgery and so on. So this is how I would look at this particular scenario. So friends, thank you so much for listening. I think it's been a useful review, and I hope that I say it's useful because I really wanted to cover some of those challenging areas I come across from some comments that we're not really sure what's going on and what next to do. So I hope it's also been helpful to you listening and on the replay. I do hope that people have been liking the video. I've been forgetting to remind us. So as you're leaving, please give this video a like and of course subscribe to the channel. And if you're watching on the replay, thank you so much for clicking on. I hope you found it useful. And just to announce that this is just the first of my How to Get Pregnant with series. I have lots and lots of videos coming up for different conditions that women have and ways that they can different options, different methods, commonly frequently asked questions around those issues that will help a woman get pregnant regardless. I think the very next one will be how to get pregnant with blocked fallopian tubes. So if you know somebody who wants to hear about that one, please make sure that they have subscribed to the channel. That video will be coming out pretty soon. Thank you so much for watching. I hope you all have a great weekend and I will see you again soon. Bye now, guys.